that each year, millions of Texans face the reality of living with a mental health condition. During the month of May, every year since I believe 1979, NAMI across the country has joined a national movement to raise awareness about mental health. Each year, we fight mental health stigma, we provide support, we educate the public, and we advocate for policies that support people with mental health conditions and their families. I want to thank you for being part of the conversation around mental health, because it's really open dialogue and collaborative problem solving that will lead to improved outcomes and access for people with mental health conditions. We're also in the midst of another important awareness event, and that is Tardive Dyskinesia Awareness Week. For those not familiar, tardive dyskinesia, or TD, is a serious side effect that may occur with certain medications used to treat mental illness. TD may appear as repetitive, jerking movements that occur in the face, neck, and tongue. The symptoms of TD can be very troubling for patients and family members. These movements are outside of the patient's control. The good news here is that treatment is available for TD and it works. And this is a relatively new scientific advancement. There are hundreds of thousands of people around the United States who are affected by TD in any given year. And now, for the first time ever, there are medications that can help a person manage their condition, can help a person manage their symptoms, and can help a person really kind of reintegrate into the social fabric of their lives and get back into the workplace and work on their goals and be part of a social life. And these are things that are important to all people. So we're really excited about these advancements in science, and we want everyone to be aware that in the first place, TD exists. It's not a household name. We want it to know that this is a serious medical condition. And two, we want people to know that there is treatment and that it's effective and that it's available. With regard to both mental health medications and TD, I will posit that we are nowhere near where we need to be when it comes to access to care, stigma, and outcomes. Thanks to many collaborative efforts, legislation, research, and a wide range of other efforts, there have been sizable improvements. For example, thanks to the actions of Governor Abbott and legislative leadership, we have a Texas Child Mental Health Care Consortium that leverages the expertise and capacity of institutions of higher education to address urgent mental health challenges and improve the mental health care system in this state in relation to children and adolescents. This passed in a bill in the 2019 legislative session, and it's already having an incredible impact on access and outcomes for children and adolescents in the state of Texas. As I mentioned, we have new TD medications that can profoundly improve the quality of life and empower the ability to re-engage with life. The impact and importance of these develops cannot be overstated, but we have a long way to go in continuing to make improvements. Each year in this state, we lose thousands of lives to suicide. Life expectancy for people with serious mental illness is much lower than the general population. And much of that is attributable to chronic comorbid health conditions that are not addressed in tandem with mental health care, and that needs to change. Jails and prisons should not be this state's largest mental health facilities, if we can even call jails and prisons mental health facilities. This is why I always try to remember to say that May, the month of May, is not just Mental Health Awareness Month. May is also Mental Health Action Month. We, the collective we, must boldly and aggressively act to ensure that all people with mental health conditions and TD, or tardive dyskinesia, receive the right person-centered care at the right time. Before I go any further, I would like to thank our co-hosting partners for this event: Mental Health America of Greater Dallas, Texas Council of Community Centers, Depression and Bipolar Support Alliance, or DBSA, Talk About TD, and the Movement Disorder Policy Coalition. Thank you so much for your support and partnership. So now that I've had the chance to welcome you and thank you for participating today, without any further ado, I would like to introduce a very special guest. It is with great pleasure and gratitude that I introduce to you the First Lady of Texas, Mrs. Cecilia Abbott. We are deeply honored by her participation in this event. Her voice is strong on the issue of mental health, and she has been an outstanding champion for access to care and eliminating mental health stigma. She has been the First Lady since 2014, and in that time, she has made mental health a key priority of hers. On behalf of NAMI Texas and our co-hosting partners, I welcome Mrs. Abbott and invite her to share her perspective on mental health. Mrs. Abbott, thank you so very much for being here with us today.
Well, thank you so much, and thank you for your kind introduction and for the tremendous work you are doing in support of fellow Texans. And thank you to everyone joining us today. I am so pleased to welcome you to this roundtable, and I hope you are all well in these challenging times that we face. Now, more than ever, we must embrace our communities, especially the most vulnerable among us. Few families have been untouched by the stress of the pandemic and by deeply felt losses. We have all seen in the news that mental health challenges have increased at unprecedented rates. Increasing access to mental health care has long been a priority for the governor. And that is why the state of Texas is investing more resources to better address health challenges that touch our entire society. That includes $8 billion appropriated in the state budget last session for expanded mental health services. During the pandemic, the state also created a mental health support line, provided crisis counseling services, and established virtual access by phone or by video for behavioral health services. And among the governor's priority legislative efforts during this current session is expanding broadband access for even greater healthcare access. From listening today, we know that mental health is critical to our overall health, but due to the side effects of some medications prescribed to treat depression and other disorders, some patients may develop metabolic conditions. I understand that between 10 and 30% of patients will at some time in their life develop tardive dyskinesia or TD. I've seen videos of people with TD and understand how difficult it must be. These conditions impact a patient's well-being and can cause their mental health to worsen. And this is why it's so important that we continue to invest in research and development so that new techniques, treatments, and medications are developed to treat the whole patient. It's all we must continue to attract talented medical professionals to this great state and grow our networks so that people can be properly screened, diagnosed, and treated. I have hope we can do all of that because there is nothing on this earth more powerful than Texans helping Texans. I want to thank NAMI for giving me the opportunity to speak here today and to recognize May as Mental Health Month and this week as TD Awareness Week. I look forward to the knowledge we will gain from today's discussion. Thank you again, and may God bless you all.
Thank you so much, Mrs. Abbott, for your powerful words. And we appreciate all the work that you and Governor Abbott have put into addressing mental health in our state. It is achieving incredible results, and we are deeply grateful for it being such a high priority for you and for Governor Abbott. I would now like to show a video featuring State Representative For Price, who is a great champion for mental health in the state legislature. So we will now move forward with sharing that video with you. My colleague will pull that video up.
Hello, I'm State Representative for Price. I thank you for inviting me to visit with you today in support of Mental Health Month and Tardive Dyskinesia Awareness Week. Also, I want to further say thank you for all of your individual and collective efforts in continuing to champion behavioral health matters in the halls of your Texas State Capitol and in our communities throughout the entire state of Texas. By working together with lawmakers, much good has been accomplished in recent legislative sessions. I'm glad to see that today's event, in addition to celebrating Mental Health Month, also recognizes Tardive Dyskinesia Awareness Week. I was pleased that the Texas Legislature passed House Concurrent Resolution 76 last session. I authored HCR 76 to call attention to this condition and encourage all Texans to learn more about the risk factors and signs of tardive dyskinesia. I'm often asked why someone who represents a largely rural district at the top of the Texas Panhandle is interested in healthcare, including mental health policy. The reason is that it directly impacts almost every family in some aspect or indirectly involves one's school campus, workplace, or neighborhood. As mentioned, the Texas Legislature has made great strides in the arena of increasing awareness and treatment for mental health disorders, including in cases of co-occurring substance use disorders. By working in a bipartisan manner and involving rural, suburban, and urban lawmakers, we have passed significant legislation such as mental health parity when it comes to insurance benefits and increasing awareness on our public school and college campuses. And we continue to build with the help of your continued professional advocacy. For example, regarding mental health parity, I'm grateful for the ongoing work of the House Bill 10 Mental Health Parity Work Group since the passage of HB 10 in 2017. Their work has resulted in my filing House Bill 2595, which includes work group recommendations to further enhance the awareness of mental health parity. House Bill 2595 was recently voted out of the House Insurance Committee and is now pending in the House Calendars Committee. As we know, integrative medicine recognizes that it is vitally important to treat the mind as well as the other parts of the human body. In recent legislative sessions, the Texas Legislature has also prioritized increased funding for mental health services, including establishing grant funds for veterans programs, for jail diversion programs, and for increased community collaboration such as crisis intervention. I'm glad that the current state budget, as recently passed by the Texas House, keeps mental health funding whole for the upcoming budget cycle. In recent state budgets, we have also paid particular attention to children's mental health initiatives. These are just some of the many successes. While all of this is much needed and well and good, more work lies ahead. With the ongoing collaboration from healthcare professionals and public, much accomplished. And the continued need is great and has been illustrated and amplified during the historic time we are all living in, one of emerging from the scourge of the COVID-19 pandemic. The pandemic has had detrimental impacts on the mental health of many, including those at home with their abusers, those who lost loved ones as a result of COVID-19, our heroic healthcare professionals and first responders, those in nursing facilities separated from their loved ones, those who lost employment or those whose businesses were strained and are still struggling, and our children and their teachers and parents, as all adapted to some form of remote learning. Therefore, we cannot rest. Together, let us continue to erase the stigma of mental health. May God continue to bless our efforts, and God bless Texas.
We are very honored that State Representative Price made that video to support this event. He is, as you might expect, busy on the floor of the Texas House of Representatives right now. But he took the time to share his thoughts and perspective with us on the topic of mental health, which has been a huge priority for him in his time in the Texas House. And we've had the privilege of working with him on many different bills related to mental health, many of which have made it into law and are having a profound impact across the state. So I'd like to thank, again, State Representative Price for providing that powerful video in support of our event. Our next speaker is Dr. Steven Sacklod. Dr. Sacklod has had a long and distinguished career in the field of mental health. and he works in various capacities to support positive outcomes for people affected by mental health conditions and TD. So we appreciate his leadership and his voice on these issues over many years, and we appreciate him joining us today to share his thoughts on Mental Health Awareness Month and Tardive Dyskinesia Awareness Week. So thank you, Dr. Sacklod.
Thank you, Greg, and I appreciate being on such an esteemed panel with everyone else in Tardive Dyskinesia Awareness Week of Mental Health Awareness Month. This is really a very important area to me. I started here in Texas at San Antonio State Hospital as a result of changes in the state mental health system, as a result of problems we had. State of Texas actually had the mental health system seized by the federal court system because of inadequate care. My position that I started at in San Antonio State Hospital as the first psychiatric pharmacist employed by the state system was directly a result of that lawsuit. That lawsuit produced tremendous changes. And in fact, in many ways, Texas still leads in some of our policies and procedures that were established over many years, a great deal of work by many people. I work hand in hand with the psychiatrists and nurses and psychologists and other professionals at San Antonio State Hospital treating people who have tardive dyskinesia. We have conducted research studies on tardive dyskinesia. I teach regularly about tardive dyskinesia. My students at the University of Texas have lectures from me as recently as last week on tardive dyskinesia. This is a very important problem because this is a terribly disfiguring disorder that impairs people's function. That's where really it comes down to where it's important. This is stigmatizing because people with tardive dyskinesia look funny. They have abnormal movements that people will notice immediately. Very mild cases look like just sort of a little strange habit, but they become quite a bit more prominent. And these are usually due to antipsychotic medications, a terrible name really, because they're used in depression, bipolar disorder, as well as disorders like schizophrenia. But there are other drugs that are similar to that that are used for motility problems, nausea, vomiting. All of these drugs, if chronically used, can cause a movement disorder, tardive dyskinesia. And when we look at Texas, Texas is a model for monitoring patients for tardive dyskinesia. The exam should be done routinely every 3 months to every 6 months, depending on the setting. The new American Psychiatric Association recommendations from last year now have embodied basically the same recommendations Texas has had for the last 35 years. These monitoring opportunities allow us to identify early cases, to restrict the medications very carefully to those that benefit from them. And also now, only recently have we had medications that allow us to treat this disorder. I've testified at the Medicaid hearings in Texas for the last couple of years about how important it is to provide these medications to our most vulnerable people. Many of our patients with mood disorders like bipolar disorder or depression, they will notice and be very distressed about the movement disorders. But people with schizophrenia, 2/3 of them don't even notice they have these abnormal movements. They just think they have a habit. So it's really important that these people bring it to the attention of their clinicians, that they get these routine exams, which has become even more problematic in the age of the COVID-19 pandemic, where many people are being seen, fortunately, by telemedicine. However, it's a little more difficult not impossible at all, but a little more difficult to do these exams by telemedicine. And I hope that we'll be able to continue providing this telemedicine service to our patients who have trouble getting to clinicians because of transportation or distance. Representative Price's area spreads over a great deal of the state. Because of that, many of his constituents have a hard time getting to their healthcare providers. Telemedicine is essential for people to be able to be seen by their healthcare providers. So I would like everyone to take the message that tardive dyskinesia is an important problem. It is stigmatizing all by itself. The people that have it isolate and stay away from other people because they're embarrassed by the movements if they're aware of them. And we have effective treatments for these problems. And I look forward to getting any questions through NAMI Texas that anybody will pass along. I'll be happy to try and answer them for you at a later time. Thank you very much for this opportunity.
Well, thank you, Dr. Sacklod. We very much appreciate your wisdom on these issues. And it really helps to put a spotlight on what this looks like, what TD looks like in the clinical setting, but also in the community. And I think, you know, there's generally a very broad lack of awareness about TD. TD is often misidentified and misdiagnosed. And if we can all collectively as family members, as friends, as providers, as community members, if we can all collectively raise our awareness of what this looks like and what options are available for people experiencing it, I think we'll see a better quality of life and better outcomes for this vulnerable group of people. So thank you again for your perspective. We very much appreciate it. I would like now to show another short video that NAMI Texas produced in partnership with our 27 local NAMI affiliates across the state. We'll show that video and then we will provide some brief conclusion remarks to conclude the event, and then we'll send you on your way. So we'll pull that video up now, and thank you all again for sticking with us and being part of this event.
Since the close of the last legislative session, our state and our sense of normalcy have shifted immensely.
Even before COVID-19 came into our lives, we were gripped by a mental health epidemic deeply affecting communities across Texas.
The physical, mental, and economic consequences of COVID-19 have exacerbated the mental health crisis impacting communities all across Texas.
Our belief in mental health must be a top priority.
We support increased funding for outpatient care. Failure to invest in these services is penny wise and pound foolish.
We support investments in psychiatric hospitals, supporting a continuum of care. No one should have to wait in jail for mental health care.
We support early mental health intervention for children, adolescents, and their families. People with other conditions get access to early care.
But on average, individuals with mental illness wait 8 to 10 years to receive the services and support they need.
When we hashtag Act for Mental Health and invest in evidence-based services, individuals avoid negative outcomes like criminal justice involvement.
40% of prisoners and jail inmates have experienced mental illness. Mental illness is not a crime.
Texas must act for mental health to support engagement and services prior to the criminal justice system. Our jails and our prisons should not be our largest mental health facilities. We need care, not handcuffs.
1 in 5 adults experience a mental health concern in a year, and expanding insurance coverage is an important step in increasing their access to care.
Mental illness can contribute to housing instability and homelessness.
Texas should invest in housing, ancillary supports, and community-based services across the state.
Members of vulnerable and marginalized communities often experience barriers to accessing mental health care.
Targeted interventions that reduce disparities in access can improve the mental health of those most in need.
A strong response to a mental health crisis is critical to starting a person down the path to recovery.
Texas should develop a coordinated system across the state for mental health crisis and suicide prevention calls.
It has never been more important for the Texas legislature to act for mental health.
Across the state, the 27 local NAMI affiliates stand with NAMI Texas in advocating to better the lives of people affected by mental illness.
We'd like to thank our 27 affiliates across the state for producing that video in partnership with NAMI Texas. It helps to show a unified message for mental health reform in the state, driven by the voices of people with lived experience, family members of people with mental health conditions, individuals with mental health conditions themselves, are all asking for the legislature and state leadership to take action on the issues that we expressed in the video. I won't say a whole lot about our specific policy priorities because there are a lot of them, and you can always learn more about what NAMI Texas is working on in our advocacy efforts by visiting namitexas.org/advocacy, where we have our full public policy platform listed, and you can sign up for our advocacy newsletter where we send out weekly updates about our progress at the legislature. As it stands right now, we are advocating in the appropriations process. The State General Appropriations Act, SB 1, is currently in conference committee, and we are making our voice heard in that process, asking for increased investments in various segments of the mental health system. We are strongly in support of continuing the investment in state hospital redesign and reconstruction. There are different proposals in the House and Senate on that topic, but we know that there needs to be increased access to care and the continuum of care in the state hospital system. We also know that we need increased investments in community-based outpatient services. There is greatly increased demand due to COVID-19 and other factors. So it's important that people get access to the right level of care at the right time. NAMI Texas is championing multiple bills relating to insurance coverage and medication access. In Representative Price's video, he mentioned HB 2595 related to mental health parity. NAMI Texas has been leading the mental health parity work group created by HB 10, and that work group produced a report providing some recommendations for how the state can move the ball forward on mental health and substance use disorder parity. Representative Price took that report and produced a bill to implement some of the recommendations. And he mentioned in his video that bill is currently in the Calendars Committee in the House. It looks like that bill is actually now headed to the House floor. So we are asking the House of Representatives to advance HB 2595 and ensure that insurance coverage for mental health and substance use disorder is fair and equitable. We also have bills related to medication access. About 3 of them are either on the House floor or will be in the House floor or are pending in the House Committee on Calendars. NAMI Texas also has a particular focus on the criminal justice system. We have several bills pertaining to jail diversion that are pending in committee or that are in the Committee on Calendars. And then also in the state appropriations process, we're advocates for continued funding for jail diversion initiatives that are partnerships between counties and the local mental health system. We're strongly in support of when it comes to mental health services for Texas youth, and new moms. We're strongly in support of bills that would extend Medicaid benefits for new moms to 12 months postpartum. We're very grateful that that is included in the House's package of healthcare reform initiatives in this legislative session. With respect to youth mental health, there are a couple bills that would require secondary schools and/or institutions of higher education to print the mental health crisis lifeline number on the back of student IDs, and that is a small, sensible measure that would increase awareness of mental health crisis resources. Along similar lines, we want to make sure that the state is prepared for the rollout of the 3-digit 988 mental health crisis lifeline number. That is a national rollout that will go into effect next year. So we have we've worked on a proposed rider in the General Appropriations Act that would require HHSC to start preparing and studying how it can play a role in implementing 988 and ensure that the services that would follow the 988 system are available for those who call the number seeking crisis services or just seeking a higher level of mental health support. A few of the bills that don't specifically relate to mental health services but are also important include public transportation, ensuring that individuals with mental health conditions are treated fairly in public transportation systems, simplifying certification and recertification of food stamp benefits for individuals with disabilities, including serious mental illness. And also we are in support of various telehealth bills that have been filed in this legislative session, some of which have been moving forward quickly, including Representative Price's HB 4, which would ensure that telehealth is available to those who are in need of services accessed virtually or remotely. Just in conclusion, I want to thank everyone for engaging in today's event. Please stay connected with NAMI Texas by visiting namitexas.org/advocacy so that you can play a role in the advocacy work that we are engaged in this session and beyond. The last comment that I want to make, more generally, not specific to advocacy, is that I want to make sure everyone knows that you are not alone. That is our message this Mental Health Month. Mental Health Month is a time of healing. It's a time of connecting. It's a time of prioritizing mental health. And it's a time of acknowledging that it's okay to not be okay. We want everyone to know that you are not alone. We don't want anyone to feel that they are alone. And that is a big part of what NAMI exists to provide for people, is the opportunity to connect with each other, provide support to each other, educate each other on what works and what doesn't work. We have various programs and services that fill those purposes. They're available through our affiliates as well as through NAMI Texas's online programming. So please visit namitexas.org to see how you might access our free online or in-person services and supports. You are not alone. NAMI Texas and our partners and our affiliates are here for you. We appreciate you, and we look forward to continuing this important conversation around mental health awareness and action and TD awareness and action. Have a great rest of your day. Thank you for being here with us today.